Yes, hello. Today we're going to talk about how spatial artificial intelligence training can help the next generation of healthcare. I'm very excited. This is one of the areas that are closest to my heart, so let's go. Uh, Now we have a triple challenge in healthcare today. One is to improve the outcome for the patients with respect to reducing the cost. The other one is the experience, the patient experience that uh, the patient has when he comes in contact with a healthcare provider, to enhance that experience in a system that today is high pressure, right, to deliver. And the third one is how to elevate the competency with the workforce, which is the critical variable in solving this equation. So patient outcomes, patient experience, and workforce competency. So let's see how we can address them. So first start with the clinical skill crisis. It used to be, when I started with healthcare more than 25 years ago, see one, do one, teach one. That's unfortunately not longer enough. You have so many new things. You have robotic surgery, you have complex procedures, you have demand for repeatable risk-free practice, right? You have med tech that has now penetrated the system, and this innovation widens the gap between the technology and the clinical skills. So you need to find a solution that addresses this challenge. Then you have the medical devices. That training is today a bottleneck. There's thousands of clinicians that need training for every new device. They need on-site, they need travel. Today there's on-site, there's travel-intensive methods, and that all takes time, costs money, and delay adoption. Hospitals in general struggle to fully leverage the new technology because they simply don't have the competence among their workers. So the third one is really close to my heart, is the patient communication deficit. This empathy, and we have a solution, I'll come back to that, which we call EON soft skills and role play, that's now deployed. But communication and empathy is important, and it will become paramount, very important very shortly because of AI taking bigger steps, that human contact. Today we have sometimes poor bedside communication that reduces the compliance and satisfaction. We have hospitals with higher scores that gain more reimbursement than others. So this is a very important component. And we need to operate and have training in a zero risk environment. We can do, it's very difficult to do surgery and train on a patient that may have drastic consequences. So virtual surgery simulators for mastering complex solution. The ability to repeat and deliberately practice until you acquire those skills, whether it's for arthroscopy in the shoulder or what have you. You need performance assessed with objective data driven, so we really know that you have the required skills before you go to a live patient. Now, digital twins, we're using that throughout our system of medical devices. So we have the ability to generate in minutes, just by using a phone, on-demand training accessible anytime, anywhere, whether it's a ventilator or any machine. All we need to do is to feed in the manuals, the books, the text to our 36 AI avatars and combine that with a video of the device capturing that, which generates the digital twin. So that allows us to do scalable learning across hospital, across global teams, and speeds up the adoption. Now, this AI-driven patient encounters, so you have training using EON soft skills, the role play, so you can design, for example, patient that has, let's say, some symptom, or that the doctor needs to tease out by asking the right questions and diagnose him. And this communication is totally done with virtual humans, right? We can also get feedback on the doctor's tone, empathy, clarity, or for the nurse that interacts with a, let's say, dementia patient. How does she handle when the patient gets agitated? What did they do right? What did they wrong? What should they have done instead? This builds the communication skills for diagnosis and care delivery. Audit-proof compliance. Compliance and certification is key. We have the ability to capture every move you make, every step you take, And this has to be done in such a way that it meets the Joint Commission and specialty boards. And the whole idea is to reduce the administration burden and the risk management, and to use this spatial AI and simulation-based technology to achieve that. Now, what's the benefits? So if you concretely, what do we achieve by implementing spatial AI? Let me give you a few. One is fewer medical errors. So that's evident, life saved. Faster device adoption that accelerates revenue. You spend lots of money for expensive MRI devices, etc. But if you don't have the personnel to train to properly use it, that results in losses and slow ROI. Higher patient satisfaction is one of my key areas, as I said earlier, and that doesn't only lead to larger reimbursement, but overall satisfaction with your patients, which is paramount. And of course, virtual training, less cadavers, less travel, less equipment cost. So what's my call to action to you? It's simple. A healthier future. How do we achieve that? Instead of just using traditional models that are not sustainable in this complex health era, start using our clinical excellence platform that's proven, scalable, and transformative. If you want to learn more about that, we'd like to engage with you. You can reach out to me, dan@eonreality.com. You can also reach out to my LinkedIn, and we'll be getting in touch. Thank you so much, and see you soon.